How does inflammation impact your scalp and hair? How should you be taking care of your scalp? If you're an individual who wants to grow fuller and healthier hair, or someone who's struggling with hair loss, well, today's video is a must watch. Hi, my name is Dr. Jenny Liu. I'm a board-certified dermatologist and welcome back to my YouTube channel. If you enjoy learning more about scalp care, ways that you can maximize hair growth for healthier and fuller hair, then you've come to the right place. I would love it if you can give this video a thumbs up and consider subscribing to my YouTube channel. Okay, today we're taking a deeper dive on scalp health and how to care for your scalp. And honestly, I feel that this is the topic that's been under-addressed or underemphasized when it comes to growing healthy and fuller hair. I think there's a lot of emphasis on products and ingredients that can stimulate hair growth, but neglect a very important topic or concept that is the overall condition and the state of your scalp when it comes to growing hair, because at the end of the day, hair grows out of your scalp. And we do know that the condition of your scalp can greatly impact not only the quality of hair that's grown out of it, but also can contribute to hair thinning. So scalp skin is skin. It just looks a little different because of the abundance of hair follicles and therefore the presence of oil glands and sebum, and also a different microbiome compared to the rest of our skin. But if you look at someone who is bald, their skin on the scalp is really essentially a continuation of the skin on the face. But when most of us who do have hair on the scalp, when we look at our scalp, it is going to be slightly different. And that just has to do with the hair follicles and the oil glands. Now, when we talk about hair growth, we are talking about the hair follicle and the stem cells in the hair follicle that is actually present within the scalp. And it's about 4 millimeters deep within the scalp where the hair bulb is found. And the hair bulb essentially is just the house, the place where houses the stem cells that produces hair. And it takes about 2 weeks for that pre-emergent process. So 2 weeks for the stem cells and the bulb to solidify or keratinize. And did you know that actually hair before it comes out of your scalp is actually liquid? So it's kind of cool. It solidifies and then basically emerges from skin. And that process is called the pre-emergent process, and it takes about 2 weeks for it to occur. And then once it emerges from the scalp, then it continues to grow about, half a centimeter a month to what we know as hair that we see and feel. Now, because hair growth starts within the scalp, the condition and overall health and state of our scalp will greatly impact the quality of the hair that emerges out of the scalp and can also affect the hair cycle. And this is where we talk about the big infamous I word, which is inflammation. And inflammation is really kind of the enemy of all things, not only that can greatly impact our health, the quality of our skin, but also our hair. And what we know about how inflammation impacts scalp as well as hair really comes from studies that we've done on chronic inflammatory conditions like psoriasis, seborrheic dermatitis, and eczema, because these conditions can greatly impact the scalp. And what we know, especially from studies of psoriasis, is that number one, in psoriasis patients that have a lot of inflammation, so their scalp is covered by psoriasis, there's red patches, flaking, itching, the hair that's growing out of it is very different. So number one, they're more fragile, they're more prone to breakage, they don't tend to grow as long. And what we can see actually when we take hairs from individuals with psoriasis and look under a special type of microscope for like detailed analysis called electron microscopy, we can actually see that number one, the cuticles of hair that's grown in patients who have severe psoriasis that's not well treated is that the cuticles are a lot more rough. They're broken. They don't lay down as flat and nice. And there often are a lot of parts of the cuticles missing or pits found on the cuticles. So that translates to what we see clinically is the hair being more rough, frizzy, more dry, and more prone to breakage. In addition, as the hair keratinizes, there's uneven keratinization of the hair fiber. So you have parts that are a little bit thicker than others, and this distorts the hair fiber. So the hair is actually a little bit more curved or twisted. And this is medically known as pili-torti, and overall can affect the strength, the texture, as well as the shine of the hair fiber. So we do know that chronic inflammation really negatively impacts the overall health of the hair that is grown. Furthermore, inflammation also affects the hair cycle. There is something called psoriatic alopecia, so hair loss due to inflammation is seen in psoriasis, and when it's enough, it can certainly affect and cause hair loss. And I've definitely seen plenty of this in patients that I've treated with psoriasis as well as severe seborrheic dermatitis and eczema. And how inflammation impacts the hair cycle is that number one, it just shifts more hair from the anagen, the growing phase, into the resting or telogen phase. So you basically have more hair that's shedding than more hair growing. So overall, the hair you're gonna be shedding and losing more hair, and the hair volume is gonna feel much thinner. Inflammation also causes hypoxia or decrease in oxygen and blood flow to the hair follicle cells, and along with that, a decrease in nutrient delivery. And so your hair follicles are really not going to get the nutrients it needs to maximize hair growth and to grow healthy hair, and also put less energy into growing hair just because it doesn't have all the right tools. So you're gonna have more hair being shed than grown. So what are some of the common sources of inflammation that our skin, our scalp sees and has to deal with on a regular basis? Well, we kind of touched up on this earlier. I mentioned chronic inflammatory conditions like psoriasis, or more commonly dandruff, seborrheic dermatitis, or eczema. But aside from those, chronic UV exposure is one of the biggest environmental triggers or risk factors for inflammation, along with smoking. And then internally within all of us is just the presence of sebum. Now, sebum itself is produced naturally by our skin, and it is a good thing, right? It has antimicrobial properties. It helps support the skin moisture barrier, reduce transepidermal water loss. But excessive sebum is not ideal. It interacts with pollutants and ultraviolet radiation and basically becomes oxidized. The lipids in the sebum becomes oxidized and generate free radicals, and that free radical is basically signal to produce more inflammation. 2, excessive sebum is really food for malassezia yeast, and we know that oily scalp tends to be more prone to dandruff, and that malassezia yeast feeds off of the sebum and then creates more additional inflammatory cytokines that feeds into inflammation. In fact, we actually have seen in clinical studies that the amount of malassezia can correlate with the amount and degree of inflammation, meaning higher amounts of malassezia yeast leads to greater amounts of inflammation identified within the scalp. And tying this all together, going back to inflammation, we see inflammation in all hair loss, whether it's scarring versus non-scarring. And I certainly have talked about the different types in my previous hair loss video, and I would encourage you to watch that if you want to learn more about the different types. And the difference is really just the amount and the degree in the cells, inflammatory cells present. But in scarring hair loss, it's so intense that not only is the patient uncomfortable, they have scalp symptoms, they have scalp findings, but also the inflammation obliterates all the hair follicles, so it leads to permanent hair loss. But even in the most common type of hair loss, so male and female pattern hair loss, androgenic hair loss, we now have identified there is microinflammation that's present. And we see this on biopsies of patients with androgenic hair loss. And for androgenic hair loss, some experts even speculate that this microinflammation from whatever the trigger is what actually catapults a susceptible individual into start losing hair. So certainly when it comes to scalp care or caring for your scalp in general, whether you're just wanting to grow healthy hair or you are experiencing hair loss, especially reducing inflammation and proper care for your scalp is really key. Okay, now let's talk about how to properly care for our scalp. The basic of scalp care is very similar to the basics of skincare, which is cleansing, moisturizing, and sun protection. Now, certainly it's not quite the same because the scalp is different from the rest of our skin, right? But that cleansing component and maintaining proper scalp hygiene is essential. You certainly don't need to moisturize as readily because most of us have hair as well as functional oil glands within the scalp that's able to pretty quickly cover the scalp even after cleansing and really help to reduce moisture loss. But that photo protection is also going to be really important. I would say when it comes to scalp routine and scalp care, it's really the maintaining the proper hygiene through cleansing and photo protection. That's really going to be key. There's always so much confusion and so many questions about frequency of hair washing. I can only give you some general guidance because it is very personal. It really depends on what your scalp type is, your hair type is, and what you do and your lifestyle habits, the things that you use on your scalp and the things that you do. So in general, basically, you don't want to go too long between hair washing. And if your scalp feels greasy, then it's time to wash your hair. And that feel can be for some people daily after washing. The next day, their scalp feels greasy. For some individuals, it may be every few days. And so it really depends on your scalp type. I would say in general, for most people, what seems to make sense is maybe every other day. But if you have oily scalp and literally if you shampoo and the next day your scalp feels greasy, then you probably want to wash your hair every day. And it's totally okay using the right products because again, that excessive sebum, if it sits on your scalp for too long, can cause inflammation. And then similarly on the other side of the spectrum, if you have more dry scalp, you certainly, number one, don't want to wash as frequently because your scalp can become dehydrated and be inflamed from, dry, damaged skin barrier, but also using the right products for when you are shampooing can be just as important. So now keep in mind that this is just our scalp at baseline. On top of that, if you are someone who exercises on a daily basis, who sweats a lot, someone who puts a lot of dry shampoo or other styling products into your hair, that may also influence the frequency and the products that may use. Essentially, what you don't want to do is to have sebum, dead skin, products, pollutants build up on your scalp over time because those drive inflammation. If you are washing daily, then use a more gentle, maybe sulfate-free formulation that's going to be devoid of harsh surfactants on a regular basis. And for the majority, unless you put a lot of products in your scalp, the regular average shampoo is enough to remove sebum and dead skin buildup. And then once a week, you may want to use a stronger, more effective clarifying shampoo just to remove everything. So gentle formulations that I find to be more conditioning on the scalp and less stripping of scalp's natural sebum. Number one, the necessary shampoo that contains niacinamide as well as panthenol and hyaluronic acid. This is also fragrance free, so another great option not only for daily use for those with oily scalp, but also if you've had eczema and dry scalp, this would be a one that I really recommend. I also have talked about this before as well. The Briogeo, their Don't Repair Despair line that has a devoid of harsh surfactants and more conditioning ingredients that is great for daily use if needed. They also have another line that's I think Ultra Gentle that is also fragrance free. That's also great for daily use. Vanna Cream Clear and Free shampoo also is great for daily use. Now, as far as clarifying shampoos, ones I've talked about and really like that I use myself is one from Olaplex, and their clarifying shampoo is one that I find to be effective at removing buildup, and so something that I would use maybe once or twice a month depending on how much products I put within my scalp. Otherwise, I love the Quay Detox shampoo that is really gentle. Over the counter, if you're looking for a good clarifying shampoo, I really like the one from Aveeno. It's the one that has apple cider vinegar in the formulation. I don't recommend using apple cider vinegar as a DIY, but when formulated into hair care products, it may have some clarifying benefits. But that one is great because it's also sulfate free, and the Quay one is also sulfate free. If you have dandruff, which I actually have been struggling quite a bit postpartum with dandruff and more oily scalp, then certainly adding in an anti-dandruff shampoo a few times a week is going to be really important. And also keep in mind that if you have severe dandruff, shampoos are not going to be enough, and you really need to see a dermatologist. And that's really another really important take-home message, is that any inflammatory scalp condition really needs to be well controlled if you're trying to grow hair, especially if you're losing hair, right? So start with the anti-dandruff shampoos over the counter, but if you're not having results, this is where prescription medications are really going to be key and really important. As a background, I am currently having a lot of dandruff flares and more greasy scalp with postpartum hormonal changes, but my hair is processed and more damaged. So one line I really have been using pretty exclusively for the past 6 months that I've been loving for my scalp and hair is from Kerastase, and it's the new Symbiose line. This line has products from shampoos to scalp scrub to conditioner, as well as conditioning mask that is really formulated with different types of yeast-fighting, sebum-fighting ingredients from zinc pyrithione to salicylic acid, but also is formulated in a way that's also really great for those with dry hair, because in general, a lot of anti-dandruff shampoos can be very drying on hair, and this line is basically helpful for oily scalp, dandruff-prone scalp, but dry hair. And I absolutely love this shampoo. It contains 1% zinc pyrithione. It's safe for color-treated hair. I don't find my hair to be stripped or dry afterwards. I use this probably about 2-3 times a week. Other anti-dandruff shampoos that are safe for color-treated hair includes this one I talked about from First Day Beauty. I'm almost actually done with their anti-dandruff shampoo that's sulfate-free that contains 1% zinc pyrithione. Jupiter also has a line, and then Dove over the counter is one of my favorites from drugstores that has zinc pyrithione, but often formulated in a more conditioning way that is really good for dry hair if you have dandruff. One thing I want to bring up is that studies have shown that for those especially struggling with androgenetic hair loss, adding in an anti-dandruff shampoo itself has been shown to reduce hair thinning, but also really help to boost the efficacy of minoxidil. I'm specifically speaking to 2 anti-dandruff formulations. Number one is ketoconazole. So you can find 1% ketoconazole over the counter as Nizoral. And we think ketoconazole helps to reduce hair thinning and helps in particular with androgenetic hair loss, is that ketoconazole itself has anti-dihydrotestosterone properties. So that hormone that really is the driver of male pattern and female pattern hair loss. Zinc pyrithione has also been shown to be helpful. Here, I think is really just acting as an anti-inflammatory, anti-yeast ingredient. And so even if you don't have dandruff, but you are struggling with hair loss, in general, when I see patients in clinic, I recommend using the anti-dandruff shampoo maybe 1 to 2 times a week. Now, if you have eczema-prone scalp, dry scalp, aside from limiting the frequency of hair washing, go with sulfate-free and fragrance-free formulation. So ones I mentioned before that I really like, including Necessaire and Vanicream. Now, over the past few years, there's been literally an explosion of scalp care products, from serums to pre-shampoo masks and even post-shampoo oils or treatments. And those are nice, but not necessary. So I kind of envision them like they're similar to serums, right? They're nice to use, but certainly not necessary, because at the end of the day, it's really the basics that are essential that needs to be done first before you kind of jump and get fancy. And I certainly think that they can have a place in your scalp and hair care routine if it makes sense for you, for your budget, for your wallet, and for targeting and treating your scalp concerns. Now, I have certainly tried a few, and so I want to share the ones that I have been using lately for my oily, dandruff-prone scalp. So one is salicylic acid-based serums to help with my itching, flaking scalp related to dandruff. And two that I really love that helps to exfoliate, remove some of that flakiness, that helps with itching, is from number one, Kerastase, their Symbiose line that contains 1% salicylic acid, 1.8% salicylic acid. And this is just a really nice watery serum. And that's the thing for me, is because my scalp is really prone to getting greasy, but more readily these days, I use really watery serums on my scalp only. And so anything that's really heavy, like oils or creams, I do not like the feel of it. So this is very watery. It applies pretty nicely. I just really apply it only to areas that are itchy and flaky. Now, this does not replace medical treatment. For me, I also use prescription anti-dandruff treatments. And so I've talked about in my previous dandruff video, updated hair care routine, so you can certainly learn more about that. But I do use this in conjunction with prescription medicine. That one does impart oiliness on my scalp, so I don't use it as frequently, but the two together, I find it to be very helpful. Another one that is watery that contains salicylic acid is from the First Day Beauty. They're 2% salicylic acid. Again, a very nice watery serum that can help to target extra flaking and itching that's related to dandruff. Now, if you are looking for more of like a creamy serum that doesn't have salicylic acid, but more that zinc pyrithione formulation, this is a really nice one. I actually have tried, and I think it's pretty good, especially if you're looking for a creamier serum. This contains 0.125 zinc pyrithione. It is more of a creamier serum. It doesn't leave a lot of heaviness or greasy residue on the scalp. But for me, like I said, I just like something that's gonna feel more watery and lightweight. But this is another great option if you're looking for a salicylic acid alternative for treating dandruff. Now, if you have more dry scalp and looking for a serum to help with hydration, the two that I've tried that I recommend is from number one, Necessaire, the scalp serum. And this is great because it's fragrance free. I really like this because it's more watery. It doesn't leave your hair feeling, sticky or greasy. It doesn't impart any film on the scalp, and it contains niacinamide, hyaluronic acid, so anti-inflammatory and hydrating ingredients respectively, along with peptides that may help support hair growth. I think we still need more data on how effective peptides are in stimulating hair growth, but certainly we know that peptides on the skin can plump the skin and reduce the appearance of fine lines and just support the skin barrier. So certainly I think this is a great serum if you are looking for a hydrating serum. The other one I've tried is from Michiru, their Scalp Tonic. That one does contain fragrance, but it also has niacinamide and glycerin, and it's a more viscous serum compared to the Necessaire, but also helps to hydrate, and the glycerin acts as a prebiotic, so may help with balancing the scalp microbiome. And if you're looking for scalp masks, free shampoo masks that either have some exfoliating benefits to help remove dead skin buildup or to help hydrate your scalp, then the ones I tried and really enjoy using myself is one from Nutrafol, Build-Up Blocker Scalp Microbiome Exfoliating Scrub. This contains a blend of fruit-derived alpha hydroxy acids. It's very creamy and in some ways kind of hydrating, I find, and moisturizing for the scalp. And it's just got these fine microparticle beads. I don't know if you guys can see on on camera these like teal colored beads that are very fine, and it's not abrasive, and it's this creamy rich mask that really gently helps to remove buildup, to keep the scalp healthy, and reduce the flaking or just sebum buildup, dead skin buildup. And so this is something I think that's like nice to do, like to pamper your scalp once in a blue moon. And it's so creamy that I think also imparts, like I said, moisturization onto the scalp. Something to do maybe a couple times a month if you are looking for a creamy, nourishing scalp scrub. And then the other one is a new product from Shea Moisture, and it's their Aloe Butter Scalp Moisture Pre-Wash Mask. So this is actually, you apply it from scalp to the end. So not only conditions and nourishes your scalp, but also can help to soften hair. It contains shea butter, niacinamide, and different blend of oils, and it's safe for color treated hair. It has this pretty thick, creamy texture, and you apply this from scalp to the ends. And I'll be honest, it is kind of hard to apply and massage it all over your scalp. Certainly, I just work it through the ends like a like a conditioning mask. What I love about it is that it really instantly, after using it, makes my hair feel really soft and nourished. I certainly don't appreciate a lot from my scalp because my scalp isn't dry to begin with. But certainly for some individuals who are looking for a mask that helps to nourish the scalp and ends, I certainly think this would be a good product to try. It does contain fragrance, so somebody who is sensitive to fragrance, you just have to be careful with that. Okay, lastly, let's talk about sun protection for the scalp, and that is very important. We know that UV exposure as well as smoking are really the two biggest risk factors for damaging the scalp. Inflammation also leads to premature graying. Now, for most of us that have a full head of hair, we may not be as inclined and find it maybe challenging to find scalp sunscreen that's elegant, that is easy to apply. And to be honest, because of that, I rarely use sun protective products on my scalp. I always go out with a hat, and certainly that can just be your mode of sun protection for your scalp. But for someone who is thinning, have a whitening part with, and that don't have as much hair for protection of the scalp against the sun, then definitely some sort of sun protecting product or hat is going to be necessary. Here, you can certainly try scalp sunscreen, and the two brands I've tried is from Sun Balm as well as Kula. In general, I tend to find sunscreen for the scalp to be very greasy, so it's one of those things where if you use it, I do recommend washing it off the night of, just to avoid any buildup that may contribute to inflammation. Otherwise, I think one trick is using powder sunscreen that can soak up some sebum, almost acts like a dry shampoo and sunscreen in one. And you can do is kind of just really brush on your part with where there's no hair covering, the scalp, and really don't have to put it all over your head. And certainly that can be an effective way to protect your scalp from the sun. But regardless, I do think if you're going to be spending excessive amount of time outside, hats are really just going to be helpful overall for protecting the scalp from UV damage. All right, and just lastly, remember any inflammatory scalp condition that is not addressed with hair care products, shampoos, then please see your dermatologist. Sometimes hair loss can be very tricky, and often when it's identified too late in the disease stage, it's sometimes not reversible and can lead to permanent hair loss. And I see this not infrequently in my clinic. So if you have any questions or concerns, don't hesitate to find a doctor or dermatologist, and that can better assist you. Again, I hope you guys found this video informative and helpful. Let me know in the comments below if you have any questions of what I talked about today. Thank you guys so much for watching, and I will see you guys next time. Bye.